Attention seniors, if you're on Medicare Advantage, you could be losing $6,800 every single year and not even know it. Last week, I spoke with a 71-year-old woman named Margaret from Tampa, Florida, who discovered she'd lost over $27,000 in just 4 years. She sat at her kitchen table with her hands shaking, staring at the paperwork she'd finally figured out. Margaret had no idea this was happening until it was almost too late. Before I show you exactly what's going on, I need to ask you something. Are you subscribed to this channel right now? Because last month, over 3,000 people told me they missed a video that could have saved them thousands of dollars. Don't let that be you. Hit the subscribe button right now because what I'm about to share is time sensitive and it affects nearly 30 million Americans. Let me tell you about Robert. He's 73 years old and lives in Phoenix, Arizona. Robert worked for 42 years as an electrician and retired with what he thought was solid health coverage. He switched to Medicare Advantage 3 years ago because the salesman told him it would save him money. The premium was $0 per month and that sounded perfect. Last September, Robert needed hip replacement surgery. His doctor said it was necessary and scheduled it for October 15th. Robert assumed everything was covered because that's what he was told when he signed up. The surgery went fine and he went home to recover. 2 months later, he opened his mailbox and found a bill for $8,347. Robert's hands trembled as he read that bill 3 times. He called the insurance company immediately, thinking there had to be a mistake. They told him the surgery was covered, but he hit his out-of-pocket maximum. Robert didn't even know he had an out-of-pocket maximum. He'd been paying for everything all year, and this was just the final bill. The representative said he owed every penny and payment was due within 30 days. Here's what makes this worse. If Robert had stayed on original Medicare with a Medigap plan, his out-of-pocket cost for that same surgery would have been $0. Maybe a small deductible, but nothing close to $8,347. Robert ended up draining his savings account to pay that bill. He called me in January, frustrated and angry. He said nobody told him about the out-of-pocket maximum when he signed up. He felt tricked. Now Robert is stuck. He can't switch back to original Medicare and get a Medigap plan because insurance companies can deny him based on his health conditions. That hip surgery is now a pre-existing condition. He's locked into Medicare Advantage unless he waits for very specific enrollment periods, and even then, his options are limited. Robert told me he wishes someone had warned him before he made that switch 3 years ago. This isn't just Robert's story. This is happening to millions of seniors right now. Medicare Advantage sounds great when they're selling it to you. $0 premiums, dental coverage, vision coverage, maybe even a gym membership. But what they don't explain clearly is the out-of-pocket maximum. Every year, you could be paying thousands of dollars before your coverage really kicks in. That's money coming straight out of your pocket. Let me tell you about Helen. She's 69 years old and lives in Jacksonville, Florida. Helen retired from teaching elementary school after 38 years. She's always been careful with money and she reads everything before she signs it. When she turned 65, she spent weeks researching her Medicare options. She thought she was making an informed decision when she chose Medicare Advantage. Helen picked a plan with a $6,700 out-of-pocket maximum. The agent told her that was the worst-case scenario and most people never hit it. Helen figured she was healthy and wouldn't need much medical care anyway. The $0 premium seemed like a smart choice. She signed up in November and her coverage started January 1st. That first year, Helen had a few doctor visits and one small procedure. She paid copays each time, usually $40 to $75 per visit. By the end of the year, she'd paid about $1,900 out of her own pocket. She thought that was reasonable. The next year, Helen developed a heart condition. She needed tests, specialist visits, and medication adjustments every few months. By June of that second year, Helen had already paid $4,200 in copays and coinsurance. She still had 6 months left in the year. Her cardiologist wanted to do a cardiac catheterization to check her arteries. The procedure was approved, but her share of the cost was $2,500. That pushed her right up to her out-of-pocket maximum of $6,700 for the year. Helen sat in her car after that doctor's appointment and cried. Here's what Helen discovered when she started doing the math. Over 2 years, she paid $8,500 out of pocket for her medical care. If she'd been on original Medicare with a Medigap Plan G, she would have paid about $3,600 in premiums over those same 2 years. But her out-of-pocket costs for actual medical care would have been maybe $400 total. Helen realized she'd lost nearly $5,000 by being on Medicare Advantage instead. Helen called me last month asking if she could switch. I had to give her bad news. Because of her heart condition, most Medigap insurance companies can deny her application or charge her extremely high premiums. She applied to 3 companies and got rejected by all of them. Now she's stuck on Medicare Advantage, knowing that every year she could hit that $6,700 maximum again if her health problems continue. She told me she feels trapped and angry at herself for not understanding this sooner. Quick question before we continue. What state are you in? I need you to comment your state name right now. The rules I'm covering change by state, and I read every single comment. Plus, your comment helps other people in your state find this video. Drop your state in the comments right now. Let me tell you about James. He's 74 years old and lives in Columbus, Ohio. James is a Vietnam veteran who worked in manufacturing for 40 years before retiring. He's been on Medicare Advantage for 5 years now. James thought he was doing fine until his wife Susan got sick. Susan is 72, and she's on the same Medicare Advantage plan as James. In March, Susan was diagnosed with cancer. She needed surgery, chemotherapy, and radiation treatments. The insurance company approved everything, but the bills started piling up immediately. Every doctor visit was a copay. Every treatment was co-insurance. Every scan and test had a cost-sharing amount. James kept a notebook tracking every single expense because he couldn't believe how much they were paying. By August, Susan had hit her $7,550 out-of-pocket maximum. James was relieved, thinking at least the rest of the year would be covered at 100%. But then James needed emergency gallbladder surgery in September. He had his own separate out-of-pocket maximum of $7,550. The surgery and hospital stay cost him $6,100 out of pocket. Between the two of them, James and Susan paid $13,650 that year. James sat down with his tax preparer in February and broke down completely. His preparer asked him why he was on Medicare Advantage instead of original Medicare. James didn't have a good answer. He said the agent made it sound like the best option and he trusted them. His tax preparer showed him the numbers. If James and Susan had both been on original Medicare with Medigap Plan G, their combined premiums would have been about $5,400 for the year. Their out-of-pocket costs would have been under $1,000 total. James realized he'd overpaid by more than $7,000 that year alone. When he went back and calculated the previous 4 years, he figured they'd lost about $18,000 compared to what they would have paid on original Medicare. James called me in tears. He's a grown man, a veteran, someone who's always been strong and independent. He said he felt stupid and taken advantage of. He asked me how this was legal. Here's what makes me angry about this whole situation. Medicare Advantage isn't necessarily a bad product for everyone. For some people who are healthy and don't use much medical care, it works fine, but the way it's sold is deceptive. Agents focus on that $0 premium and all the extra benefits. They don't sit down and explain what happens when you actually get sick. They don't show you the out-of-pocket maximum and compare it to what you'd pay on original Medicare with a supplement plan. The insurance companies make billions of dollars from Medicare Advantage. They get paid by the government for every person who enrolls. The more people they sign up, the more money they make. So they hire armies of salespeople to knock on doors, call phones, and set up tables at grocery stores. These agents earn commissions for every person they switch over. They have a financial incentive to sell you Medicare Advantage, whether it's right for you or not. And here's the thing that really frustrates me. Once you're on Medicare Advantage for a while, it becomes very difficult to switch back. If you develop any health conditions, Medigap insurance companies can deny you in most states. There are only a few situations where you have guaranteed issue rights. That means you could be stuck on Medicare Advantage for the rest of your life, hitting those out-of-pocket maximums year after year. Let me tell you about Dorothy. She's 70 years old and lives in Dallas, Texas. Dorothy worked as a nurse for 45 years before retiring. You'd think someone with her medical background would understand insurance, but even she got confused. Dorothy signed up for Medicare Advantage when she turned 65 because 3 different agents told her it was the smart choice. She trusted them because they seemed knowledgeable. For the first 3 years, Dorothy was fine. She's relatively healthy and only needed routine care. She paid small co-pays here and there, maybe $800 per year total. She thought she'd made a great decision. Then in year 4, Dorothy fell and broke her hip. She needed surgery, rehab, and physical therapy for months. The bills started coming in immediately. Dorothy's out-of-pocket maximum was $6,800. She hit it by April. That year alone, she paid the full $6,800 plus her prescription drug costs, which were separate. The next year, Dorothy developed complications from the hip surgery and needed a revision. She hit her out-of-pocket maximum again. 2 years in a row, she paid $6,800 each year. That's $13,600 total. Dorothy finally talked to a friend who was on original Medicare with a Medigap plan. Her friend explained that she'd had 2 surgeries in the past 3 years and paid less than $500 out of pocket total. Dorothy was shocked. She immediately tried to switch to a Medigap plan. She applied to 5 different insurance companies. Every single one denied her because of her hip surgeries and the complications. They considered her too high risk. Dorothy called me frustrated and defeated. She said if she'd known this 5 years ago when she first enrolled in Medicare, she would have chosen differently. But nobody explained the downside to her. Nobody showed her the comparison numbers. Nobody warned her that she could get locked into Medicare Advantage. Now she's stuck paying that out-of-pocket maximum every time she has a bad health year. She told me she feels betrayed by the system. If this information is helping you right now, I need you to do something. Hit the like button on this video. Here's why that matters. The more likes this gets, the more YouTube shows it to other people who need this information. It takes literally 2 seconds. Do it right now while you're thinking about it. Now listen carefully to this part. I'm not saying Medicare Advantage is evil or that nobody should ever choose it. For some people in specific situations, it can work fine. If you're healthy, you don't go to the doctor much, and you want those extra benefits like dental and vision, maybe it's okay for you. But you need to understand what you're getting into. You need to know about that out-of-pocket maximum and what it really means. Here's what they don't tell you in those sales presentations. The out-of-pocket maximum on Medicare Advantage plans can be as high as $8,850 for in-network services. Some plans have even higher maximums if you go out of network. That means every single year you could potentially pay up to $8,950 before your coverage pays 100%. If you have a serious health condition, or you need surgery, or you get sick, you're probably going to hit that maximum. Compare that to original Medicare with a Medigap Plan G. Plan G is the most popular supplement plan right now. The premium varies by state and by age, but nationally it averages around $150 to $200 per month. That's $1,800 to $2,400 per year in premiums. But here's the beautiful part. Once you pay that premium, you have almost no out-of-pocket costs when you go to the doctor or hospital. You pay the Medicare Part B deductible, which is $257 for 2026, and that's it. Everything else is covered. Let me do the math for you. If you're on Medicare Advantage and you hit your out-of-pocket maximum of $6,800, you've paid $6,800 that year. If you're on original Medicare with Plan G, you pay maybe $2,200 in premiums plus the $257 deductible. That's $2,157 total. You just saved $4,343 that year. Now multiply that over 10 years or 20 years. You're talking about saving $40,000 to $80,000 over your lifetime just by being on the right plan. But here's the catch. You can't just switch whenever you want. When you first become eligible for Medicare at age 65, you have a 6-month open enrollment period for Medigap plans. During that time, insurance companies cannot deny you or charge you more based on your health. They have to accept you. That's your golden window. If you choose Medicare Advantage instead, and you stay on it for a few years, you lose that protection. After that initial 6-month window, insurance companies can medically underwrite you. That means they can ask about your health conditions, look at your medical records, and decide whether to accept you or not. If you've been diagnosed with diabetes, heart disease, cancer, COPD, or dozens of other conditions, they can deny you. Or they can accept you but charge you double or triple the normal premium. Most people can't afford that. There are a few exceptions called guaranteed issue rights. If your Medicare Advantage plan leaves your area, or if you move out of the plan service area, or a few other specific situations, you can get guaranteed issue rights to buy a Medigap plan. But those situations are rare. For most people, once you're on Medicare Advantage with health problems, you're stuck there. Let me tell you about Patricia. She's 68 years old and lives in Denver, Colorado. Patricia is a widow who retired from working at a bank. She went on Medicare Advantage 4 years ago because she was healthy and wanted to save money on premiums. For 3 years, everything was fine. Then Patricia was diagnosed with rheumatoid arthritis. Her doctor prescribed expensive medication and she needed regular specialist visits. In that first year after her diagnosis, Patricia paid $5,900 out of pocket before hitting her maximum. She was frustrated but figured it was just one bad year. The next year, her arthritis got worse and she needed even more care. She hit her out-of-pocket maximum again, this time $6,300. Patricia decided she needed to get off Medicare Advantage and onto a Medigap plan. Patricia applied to 4 Medigap insurance companies in Colorado. 3 of them denied her outright because of the rheumatoid arthritis. The 4th company offered her a plan, but the premium was $487 per month instead of the normal $165 per month. They were charging her $320 extra every month because of her health condition. That's an extra $3,864 per year on top of the regular premium. Patricia did the math. Even with that inflated premium, she'd still save money compared to hitting her out-of-pocket maximum every year on Medicare Advantage. She accepted the expensive plan, but she called me angry and upset. She said nobody warned her about this when she signed up for Medicare Advantage. Nobody told her that her health could change and she'd be penalized for it later. She feels like the system is designed to trap people. Think about someone you know who needs to hear this. Your mom, your dad, your neighbor, your friend from church. Someone who could lose money if they don't know what I just explained. Share this video with them right now. Copy the link, text it to them, email it, however you communicate. Do it now before you forget. This information is too important to keep to yourself. Here's the truth that nobody wants to say out loud. Medicare Advantage benefits insurance companies more than it benefits seniors. The government pays insurance companies a set amount for every person enrolled in Medicare Advantage. The insurance company makes money by keeping your medical costs below that amount. So they have a financial incentive to deny care, delay care, or make it difficult for you to get the care you need. I'm not making this up. There have been investigations and lawsuits about Medicare Advantage plans denying necessary care. They use something called prior authorization, which means you have to get approval before you can have certain procedures or tests. Your doctor says you need an MRI, but the insurance company says no, try physical therapy first. Your doctor says you need to see a specialist, but the insurance company says no, see your primary care doctor again first. This doesn't happen as much with Original Medicare. Original Medicare doesn't require prior authorization for most services. If your doctor says you need something and it's medically necessary, Medicare covers it. You don't have to call an insurance company and beg for approval. You don't have to appeal denials. You just get the care you need. That's worth something. That's worth a lot, actually. Now here's the good news. If you're currently on Medicare Advantage and you want to switch, you might still have options. It depends on your situation, your health, your state, and the time of year. I'm going to give you specific steps in a minute. But first, let me tell you about one more person who got out successfully. Let me tell you about Linda. She's 72 years old and lives in Atlanta, Georgia. Linda was on Medicare Advantage for 2 years and hated it. She'd paid over $11,000 out of pocket in those 2 years and felt like she was getting terrible care. Every time she needed something, there was a delay or a denial or a fight with the insurance company. She wanted to switch to Original Medicare with a Medigap plan, but she was worried about being denied. Linda got lucky. Her Medicare Advantage plan decided to stop offering coverage in 3 counties in Georgia, including hers. That meant Linda had a guaranteed issue right to buy a Medigap plan. The insurance companies couldn't deny her or charge her extra based on her health. Linda jumped on that opportunity immediately. She enrolled in Medigap Plan G in November, and her coverage started January 1st. Linda called me 2 months later to tell me how much better everything was. She said she could see any doctor she wanted without asking permission. She didn't need referrals or prior authorizations. When she needed an MRI, her doctor ordered it and she got it done within 3 days. Her out-of-pocket costs dropped to almost nothing. Linda told me she wished she'd never gone on Medicare Advantage in the first place, but at least she got out when she had the chance. Here's exactly what you need to do right now. I'm going to give you 5 steps. Each one is simple and specific. You don't have to do everything today, but you need to start with step 1 this week. Write these down or save this video. Ready? Let's go through them. Step 1. Call your current insurance company or check your plan documents and find out your exact out-of-pocket maximum. This is the most you could pay in a year for covered services. Write that number down on a piece of paper. Then add up what you've actually paid out of pocket for the last 2 or 3 years. Include all your co-pays, co-insurance, and any bills you paid yourself. Compare those numbers to what you would have paid on Original Medicare with Plan G. You can use Medicare.gov to get Plan G premium quotes in your area. This will show you if you're losing money or not. Step 2. Look at your health situation honestly. Do you have chronic conditions that require regular care? Do you take expensive medications? Have you had surgeries or hospital stays in the past few years? If yes, you're probably better off on Original Medicare with a Medigap plan. If you're very healthy and you rarely go to the doctor, Medicare Advantage might still work for you. But remember, your health can change anytime. Do this assessment today and be honest with yourself about your medical needs. Step 3. Find out if you have guaranteed issue rights. Go to Medicare.gov and search for guaranteed issue rights. There's a chart that shows all the situations where you can buy a Medigap plan without medical underwriting. If your Medicare Advantage plan is leaving your area, if you're moving, if your plan lied to you, or several other situations, you might have guaranteed issue rights. If you do, act immediately because these rights are time limited. You usually have 63 days from the event to enroll. Don't wait or you'll lose that right. Step 4. Talk to an independent insurance agent who sells both Medicare Advantage and Medigap plans. Do not talk to an agent who only sells Medicare Advantage because they're biased. You need someone who can show you both options honestly. Ask them to run quotes for Medigap Plan G in your area. Ask them to explain the total yearly cost including premiums. Then compare that to your Medicare Advantage out-of-pocket maximum. Get this information in writing. Do this before the annual election period ends if possible. Step 5. If you decide to switch from Medicare Advantage to Original Medicare with Medigap, you need to do it during the right time period. The annual election period runs from October 15th to December 7th every year. During that time, you can drop your Medicare Advantage plan and go back to Original Medicare starting January 1st. Then you have until March 31st to apply for a Medigap plan under certain circumstances. But remember, if you don't have guaranteed issue rights, the Medigap company can deny you based on your health. Apply to multiple companies if you need to. Don't give up after one denial. Step 6. If you can't get a Medigap plan because of medical underwriting, consider switching to a different Medicare Advantage plan with a lower out-of-pocket maximum. Not all Medicare Advantage plans are the same. Some have maximums as low as $3,000, while others go up to $8,850. You can switch Medicare Advantage plans during the annual election period without medical underwriting. Look at plans in your area and compare out-of-pocket maximums, provider networks, and drug coverage. Even if you have to stay on Medicare Advantage, you can at least minimize your financial risk by choosing a better plan. Let me recap what we just covered. Medicare Advantage plans can cost you $6,800 or more every single year when you actually need medical care. That's because of out-of-pocket maximums that most people don't understand when they sign up. Original Medicare with a Medigap Plan G usually costs much less over time, especially if you have health problems. But once you're on Medicare Advantage with health conditions, it's very hard to switch back because insurance companies can deny you. You could be losing thousands of dollars every year and not even realize it until it's too late. Remember Margaret from the beginning? After she learned about this issue, she found out she had guaranteed issue rights because her plan had misrepresented benefits to her. She applied for Medigap Plan G and got accepted. Her out-of-pocket costs dropped from $6,800 per year to under $500 per year. She called me last month and said switching to Medigap was the best financial decision she's made in retirement. You can do the exact same thing if you act now and follow the steps I just gave you. If this video helped you, here's what I need you to do. First, subscribe to this channel so you don't miss the next urgent update. Second, share this with someone you care about, someone who needs this information. Third, leave a comment telling me your state or your situation. I read every comment and I try to respond to as many as possible. Your comment also helps other people find this video and protect themselves from losing money. One more thing, this video is for educational and informational purposes only. It is not legal advice, financial advice, insurance advice, or medical advice. I'm sharing general information, but every situation is different and rules vary by state. Before you make any decisions based on what you heard here, please consult with licensed professionals like insurance agents, financial advisors, or attorneys who can look at your specific situation. What works for one person may not work for another.